bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, the Holland Bloorview Children's Rehabilitation Hospital Foundation, the Children's Hospital Foundation of Saskatchewan, and Trillium Health Partners. We would also like to thank the following Keystone and program partners for their ongoing contributions that support all of CAFC's programs and activities. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can also share your thoughts and questions on Twitter by tagging @CAFCTweets and using the hashtag CAFCPresents. All of our webinars are recorded and can be found on the CAFC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the CAFC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive.
All right, hello everyone, and welcome to today's episode of CAFC Presents. I'm Doug Maynard, the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres. And today we're going to talk about safe transportation for children with orthopedic conditions and current roadblocks. And this is a really interesting session that came to our attention about a year ago. Dr. Richard Stanwick, who's joining us on the panel today, contacted us with an issue that he became aware of, and that was the issue that the company that was producing the Hippo car seat, which is a car seat that can accommodate children with hip spica casts, they were discontinuing the product, and he wasn't exactly sure what options he had available to them as far as alternate devices, etc. It was a new issue for us at CAFC, but we really saw this as an opportunity for us to leverage our national network of hospitals that are discharging children with these casts, our rehab network who's regularly dealing with children with cast issues or other physical deformities that make it difficult for them to safely occupy a standard car seat. So we sent a short survey out to our audience just to ask about issues related to car seat, the Hippo car seat in particular, whether people were aware of it being discontinued, what alternatives they might be aware of, etc. And it was a really interesting response that we got back. It was everything from they were completely unaware of the issue, and there was a sense of panic that they were surprised by this, and they weren't sure why they weren't aware of this, and they weren't sure what they were going to do. There were people who were aware of the issue and thought that they had certain alternatives that would be relevant, like instead of the Hippo car seat, there was the Easy On vests and other devices that people were aware of. There were many. I think the most common response was along the lines of, well, we did hear that the seat was being discontinued, so we went out and bought a bunch. We're good for the next few years until they expire, but after that, we're really not sure what we're going to do. There were lots of other comments related to sort of tricks that they used to get around the regulations, requiring people all sorts of hoops that they would go through to get doctor's notices, assumptions that were being made around whether or not insurance companies would cover children and accidents involving children in these car seats. I think there were assumptions without any evidence that insurance would cover them, etc. So there was a lot of confusion, a lot of potential misinformation. It was really an interesting conversation that Dr. Stanwick started when he approached us. So I think there's a real opportunity here to talk about what an organization and a network like CAFC or the Canadian Pediatric Society can do from an advocacy perspective, and to really talk about this as a real issue for children with disabilities and families that are dealing with this, and how we can support them and maybe talk to policymakers to make a change. So it's going to be my pleasure to introduce our panel today. As I mentioned, we have Dr. Richard Stanwick, who is the Chief Medical Officer for the Vancouver Island Health Authority in Victoria, British Columbia. He's responsible for overseeing a wide variety of critical care public health programs, as well as engaging in advocacy and seeking general improvements in in public health. He's also joined by, following, as part of this research, we of course reached out to our colleagues at the Shriners Hospital for Children in Montreal, and of course, as it turns out, they've got a long history of investigating sort of issues related to car seats. So we're happy to welcome Nathalie Bilodeau, who's an occupational therapist at Shriners Hospital for Children since 1999. She's developed an expertise in evaluation and treatment of the upper extremity over the years, with a special interest in hand anomalies. And she's also very active in updating the car seat loan program at the Shriners Hospital, and in particular she keeps track of recent changes in car seat equipment and has established important links with community and government stakeholders. And joining Nathalie also from Shriners Hospital is Kathleen Montpetit, who's certainly a familiar name for those of you involved in our rehab network, CINSER, our Canadian Network of Child and Youth Rehab. She's been affiliated with the hospital since 1979. She's desperately trying to retire. I think she says she's retired, but she still seems to be hanging around. She worked initially as an occupational therapist and later as the director of rehab services and coordinator of the clinical research and outcomes program. So it's a great pleasure to welcome this great panel. And first off, we're going to hand over. We're going to go all the way out west early in the morning for Dr. Richard Stanwick out in Victoria. Over to you, Dr. Stanwick.
Okay. So, in terms of this presentation, I want to thank CAFC for partnering with CPS. The other thing that, I actually got my pediatric training before I went into public health, and currently, perhaps this is my first task as the Recycled Injury Prevention Committee chair. But as always, sometimes how these things come to people's attention. It was one of our car seat technicians who actually she's one of the top people in British Columbia, drew this to my attention as, this issue, if you could just kindly look into it. And I think the advice to anyone is, if a car seat technician approaches you with a small problem, run. Yeah, okay, so we'll leave it at, because it was absolutely fascinating to see what happens. Now, let's see if this will work. Oh, no. So in terms of disclosures, just as a member of the Royal College, I basically have no ties to any manufacturers of seats. This basically, I will not specifically approve or suggest any particular model over any other. What is different, is that I will actually discuss, and this is something that I have never done in any presentation, an unapproved or investigative use of a commercial product. And so this is actually the whole crux of our conversation. And so the learning objectives would be that you would be able to identify the standard that's applicable to special needs, reference the factors that motivate certification, and of course, what we really hope to do from this session, in addition to what I suggest, is to come up with some advocacy strategies that will certainly enhance the availability of these safety devices. And honestly, the car seats have now fallen into a very dubious category, and that is a pediatric orphan, potentially. This is something that's very commonly referenced in basically the pharmacy side of things in terms of the treatment of children with usual or unusual diseases that require specialized medications. And, truly we want to avoid the fact that transporting children with special healthcare needs, avoids being put into that particular category. And again, I know that for many people on this call, I will quite candidly acknowledge, who likely have much greater expertise in the actual day-to-day activities, just approaching it from the perspective of somebody who wasn't familiar with the ins and outs. If you basically look to the general advice that one might find on a friendly website, and I just picked on my own province, our Healthy Families BC, which is certainly one of the big health promotion agencies in British Columbia, speak to this whole issue of car seats. And of course, one of the major things they emphasize is, do not basically purchase a car seat that does not meet the Canadian motor vehicle safety standards, and to look for that particular sticker on your seat. Now, and again, just for clarity purposes, this is what the national safety mark would look like. And in particular, the YYY in the middle actually would be replaced by the appropriate standard, and those are listed below. And just for greater clarity, this is what Transport Canada requires, and these are the actual parts of the regulation that specifically addresses and speaks to the test methods required for the different types of child, infant, and booster seats. And in particular, the ones that I've highlighted at the bottom of that particular slide, speaks to the two special labels that one would look for and were previously on seats brought into this country, and that is the CMVSS 21.3 and 0.5. Now, this testing, and I can say I have been very much involved with the Canadian Standards Association with everything from alpine helmets, bike helmets, and a few other devices, including playground safety, and appreciate the complexity of doing proper testing and having the appropriate testing lab. The testing itself often involves the destruction of the various devices, so it's often 6 to 10 models of that particular product are destroyed in the course of verifying that it meets particular standards. And here's an example, just again drawn from the literature, where Britax actually prides itself on the high quality testing facility that it utilizes to continue to improve car seat safety. So this is not a modest undertaking. This really is, in fact, a fairly complex issue, and certainly you can see that there are costs associated with it. Now, in looking at what was available, and this is again just part of my own education process, and for people on the call, I'm sure they're very much more familiar with these devices, such as the Easy-On adjustable vest. What is interesting, I found in the United States, though, is that this company has even actually partnered with my sister organization, the American Academy of Pediatrics in the United States, and Save Kids, to basically be partners in promoting safety. And so it shows a very, I think, positive working and I think corporate relationship with the safety organizations in the United States. Interesting, this very same vest, and this is taken from Patterson Medical, where they actually speak to this, and I don't expect you to read all the fine boomph, but it's basically the bottom line on that particular graph, and it said, not all medical devices advertised are licensed for sale in accordance with Canadian law. And that again speaks to the conundrum we're facing, because the major company which we've had dealings with is the R82 Incorp. There's been certainly some corporate changing of ownership, but if one looks at the catalog they provide, this is just a typical page, and this is actually the American page for transportation, and as you can see, they list the Traveler Plus, EL, and the Hippo. However, if you go to the Canadian catalog, basically you get the bottom line. Again, the important thing is it says, unfortunately, the Traveler Plus EL isn't currently available from our 82 inventory. They are sold out, and production may resume in the fall of 2016. But of course, what they don't say is that, in fact, the seats will not be sold in Canada. And so this is the actual formal communication, and I do want to thank people like Jocelyn Petter and Judy Dryden who have been actively communicating with the company, and I know, and I really would like to hear what other folks have heard from this company who've also likely engaged in the communication, but that they basically said that they pretty well sold out their inventory of car seats across Canada, including Quebec, which I don't understand why Quebec got special treatment, but maybe there is something separate and distinct about Quebec. But the interesting thing is that they said that the Traveler Plus will continue to be available from the U.S. for about a year. What they did indicate is the American product, and they're clearly going to be changing that, and it's the same product but does not have the critical Canadian label. And so they close with a comment, and this is from their manager of sales, in accordance with Transport Canada regulation, the car seat must be prescribed by either an OT or physician. Now, interestingly, I wanted to see what the Canadian Border Services thought about bringing in car seats and booster seats, and they basically say that any Canadian who wants to import them should contact Transport Canada. So over to Transport Canada. And of course, this is where one has the most fun, where again Transport Canada emphasizes its role is not to rate, endorse, or approve car seats, of any form, but in fact that their role is to take care of Canadian legislation such as the Motor Vehicle Safety Act. The Transport Canada develops and enforces the regulations around restraint systems and booster seat safety, and they actually specify shall we say, the technical side of things, such as administrative labeling, instructions, etc., that are required, sort of prescribing, again, what would be needed for all types of seats, including those for restraint systems for disabled persons. And so while they say that it's their responsibility for developing these requirements, at the end of the day, it's the manufacturer's responsibility to certify that its products meet the applicable requirements. And then again, the manufacturer affixes a national safety mark. This is where I had, this is when things really got quite interesting at the time of assembly to show that it meets those requirements. And so again, Transport Canada keeps emphasizing that it merely monitors, ensures that it serves as an advisor to manufacturers on what they need to do to basically ensure their seats are safe, ranging from compliance testing to, of course, speaking to failures of their product. And of course, if you or I have a complaint, these safety defects are basically an opportunity for Transport Canada to enter into a dialogue with the manufacturer. And so the interesting thing, though, at the end of the day, Transport Canada, though, says, well, actually, even though Canadian Border Services referred you to us, that best thing you do is actually contact the manufacturer directly regarding its certification status. But the most amazing language, and this is where I encountered bureaucracies that actually left my head spinning, in that if you actually, perhaps let people give a moment to read the issue of Section 104 that prohibits any company to import into Canada a restraint system other than a set of disability for custom restraint is not designed to be used only in school buses or booster seat unless they have an affixed national safety mark. And then they go further in saying, so to import restraints for a company, the only exception to the obligation to affix the national safety mark is custom restraint designed for disabled persons that is not designed to be used only in school buses. I'm sure I've probably lost most of you at this point. If not, we have a few lawyers in the crowd. So this is clearly legal boomph that's put together. And so that all restraint systems for disabled persons that is not designed to be used only in school buses does not have to meet the dynamic testing standards. And I'm not really sure, I still have not basically figured that out entirely, but is it really encouraging? However, they do indicate that it still has to meet a whole bunch of other standards referenced in the Act where the term is mentioned for restraint or custom restraint. So at the end of the day, Transport Canada recommends that you contact the manufacturer directly for information regarding its certification status. So the difficulty is, sticking to the sticker. We do have our Canadian sticker, and we certainly have it on products still coming into Canada that meet it for basically booster seats and car seats for the average infant and child. But the question is the American standard, which, as you can see, there's a matter of two letters, and even the 213 is the same code that we use in Canada, is currently not deemed acceptable. So I thought I'd, just for a little bit of enjoyment, to see if I could find out what the provincial laws and regulations really specify in terms of these specialized seating. And again, it's not I would put a review that I would necessarily say would be of the same rigor that a lawyer would find, but certainly as a semi-skilled layperson to find out exactly what my province might be telling me in terms of these specialized codes and where and if they're embedded in legislation, specifically for infant seats, which are covered by 213.5, and disabled persons 213.3, which of course would be the older child. And it's interesting that in doing a provincial territorial scan of legislation, in terms of references to specialized seating specifically, in other words, citing the actual 213.3 and 213.5, you can see the list of provinces that don't specifically name it, but you could, according to a legal friend of mine, imply it, because they actually indicate special needs are covered by the Motor Vehicle Safety Act, which then loops back and does reference those particular standards. Nova Scotia, Ontario, Quebec, and British Columbia actually reference those actual portions of the regulations. Now, how do you get a seat now? And again, Nathalie provided this information, and if I didn't get it exactly right, Nathalie, it's my fault. That, if you're somebody who wants one of these seats, you actually get a request from a physician to Transport Ministry. The permit is granted by the Ministry of Transport, and the car seats under these permits can be loaned to families. Ontario, I put in calls to all of the people or groups that might have been responsible, or emailed them. And it's interesting, Ontario still had this requirement that it should meet this particular level of quota, and there's nothing in the literature that was provided by that government that suggested how you'd get around it. But I imagine if you were persistent, you might eventually reach somebody. Manitoba, it was interesting, got direct communication back from a person in their safety branch that they say a company would not be permitted to import or sell the restraint. But they did find that private importation of such restraints may be permitted. And this is interesting. The word may reflects the fact that Health Canada could take action under the general prohibition of the Consumer Product Safety Act if there was ever a clear danger to human health or safety and enforcement was required. And this would clearly not apply to typical seats because, again, the belief was that if it meets the U.S. safety standard, this likely would not happen. However, at the end of the day, the importation of equipment by person or organization for their own use would be considered a private importation, and they would see no problem with it. Saskatchewan was great. I just want to tip a hat to Travis Holha. I got a sort of a negative response initially from government, but then it turns out the Saskatchewan Prevention Institute works really closely with hospitals in Saskatchewan, the Saskatchewan Disabilities Council, and then the Disabilities Council works with Prevention Institute, mainly Travis, and they are able to get the seats into the hands of individuals. And again, it's this whole idea of bringing the seats in. Alberta, it was a little seemingly more definitive. I did not hear back from them. And in British Columbia, I had the most fun where I basically got put in a perpetual loop of being sent through basically the Ministry of Transport, who said, no, this is Road Safe BC, and Road Safe BC said, no, it's ICBC, and ICBC said, no, it's the Minister of Transportation. So I'm still closing the loop on that one. It's a bit distressing because it goes beyond the fact that in addition to confusion in British Columbia, we do have a specialized program for families that may not have the sufficient resources to purchase needed equipment for dealing with their children with special needs. And the interesting thing is that this group will no longer fund seats lacking the CMVSS label. So this is really a bit of an issue that in terms of dependents and loaner programs, this may be the only option. And even then, again, the programs that have to recognize that these people may not be in a position to contribute substantively to the cost of the loan. Now, the other piece that was interesting, and people may have caught it a couple of times, there was the suggestion that there could be a seat brought in either prescribed by an OT or a physician. And I decided I'd give my colleagues at the Canadian Medical Protective Association a call. And they basically were made aware, and they found this totally fascinating because they too had never been made aware of this particular set of circumstances. And so that, the idea of a physician recommendation to provincial authorities. And so the question I posed to them is there liability on the part of the doctor in sanctioning a non-CMVSS approved seating device? And so we had a good half-hour chat. And really at the end of the day, their feeling was that we need to focus on a standard of practice and what is medically necessary for that individual for safe transport. That should override the concerns that you have an obligation and responsibility to provide the best possible care to the individual that you are the doctor of record. And so they felt that the critical test was that there was due diligence by the care provider. And they had a very interesting suggestion that one way in which they would feel much more comfortable in reassuring physicians who might take this upon themselves would be that there be developed a standard of practice for these non-CMVSSs by either for example, the Canadian Pediatric Society or some other authoritative child health organization. And so that this would actually be the CPS, just by way of example, coming out with that under circumstances where such and such and such is not available, that the organization or individual can secure a recognized safety standard. And again, we could even specify American. That would go a long way to ensuring that the Canadian Medical Protective Association would feel comfortable supporting any physician who got sued because some of misevent that occurred involving one of those basically approved seats. So now, what type of organizations? I mentioned the CPS, and of course, I've always had a great partnership with CAFC. And so the question is, what can some of our national organizations possibly do in moving this forward? And I think one of the suggestions was that perhaps as even a short interim measure that we develop some sort of general standard of practice in the event that seats are not available in a particular province as basically indicated by legislation, but that physicians should feel comfortable in being able to sign off on the request for them. But there was also a suggestion that, and this is one that certainly Travis and others have talked about, and I've sent a letter to Minister Garneau and have not heard back yet, about the idea for us to work more closely with Transport Canada, because another, shall we say, way around this, or a workaround, and though it would probably cause a lot of work at the federal level and may even be precedent setting, would be that we actually look at harmonization of some of our standards. That in many cases they're very, very, very close. I know early on in car seat safety, when we insisted on the tether strap, which certainly was a superior means of anchoring a child's car seat in the car, there were significant discrepancies in the testing methodologies and requirements for the different seats, and that's certainly been the case over time. The issue is, how close are the two standards and the two requirements in terms of basically regulation? And, is there opportunity for Canada to perhaps look at the idea that either sticker would be approved for basically, consumer purchase? Other opportunities would be, and this is even going further, is that what if there was a company that decided to engage in some corporate goodwill and take it upon themselves to not only import the seats, be the distributor, in other words, for Canada, but also take on the responsibility of paying for the cost of certification so that these seats would have the appropriate sticker. That would be a more complicated and I think costly program, given the wide variety of seats that perhaps may need to be considered for use in children with special needs. So is this a practical solution, or would it result in only perhaps a partial solution to the issue? Again, it's being explored, it's being certainly talked about at the CPS, but clearly there must be other options in which we can advocate and ensure that children are properly protected. Now, I want to just thank everyone. I really do admit that this is something I've come to late, and I do recognize there's lots of expertise on this webinar, and actually do look forward for other suggestions from everything from advocacy to how we could work better with everything Canadian Medical Protective to, of course, our local provincial officials. So thank you for indulging me in this little trip down the car seat road.
Thank you very much, Dr. Stanwick. I think that was possibly the most entertaining walk through government regulations I've ever experienced. I thought that was very, very good. And certainly if not presenting us with a lot of specific answers, certainly highlighted the fact that it's a very complicated thing. And it's complicated for clinicians to figure out what it is they're supposed to do. And I can only imagine how hard it is for families that are trying to figure this out on their own and getting some sort of a sense of clarity around what actually they are supposed to be doing with respect to these seats. So thank you very much for that. So now it's we're going to move east to Montreal, to the Shriners Hospital for Children, to hear from Kathleen and Nathalie, who they don't want me to promise that they're going to provide you with specific answers, but they're certainly going to share some of their research and experience over quite a number of years in looking at car seat issues and how they've dealt with it, at least in the province of Quebec. So over to Nathalie and Kathleen.
Thank you very much, Doug. This is Kathleen speaking, and I want to also thank you, Dr. Stanwick, for a really fascinating overview of the whole issue of regulations and the back and forth between the two countries, across our country, and among all the regulatory agencies. It really is quite a puzzle to try and figure it all out. So our presentation is going to be slightly different from Dr. Stanwick's. His dealt with more the current situation. We're going to do a little bit of a review of what we've done in the past, and then focus on how we're coping with the problems that we're facing. So just to go back, in the early 90s, the need for this service was becoming irrefutable as family life evolved to two-income families and daycare. Given our pediatric orthopedic setting, the volume of requests for special car seats was considerable and quickly became a weekly occurrence. We made every effort to stay current and over the years shared our experience with other sites. It has always been a challenge to keep track of who are the regulatory agencies, the changing regulations themselves, and also provide a service that is first and foremost safe, and of course, following ethical and legal guidelines as much as we possibly could. So just to put you in a context, the Shriners Hospital for Children is a specialized pediatric orthopedic hospital that is part of a network of 22 hospitals that exist across North America. Because of our mission, ensuring safe transportation has very unique challenges. The conditions treated at our sites are such that standard car seats do not work. Babies with DDH, developmental hip dysplasia, often require surgery and then immobilization with their hips flexed and abducted for anywhere from 3 to 9 months, perhaps even longer. As well, many other orthopedic conditions are treated at our hospitals, things like arthrogryposis, leg calvé-perthèse, children with cerebral palsy who have hip dislocations. All of these children may require surgery that may undergo surgery that then requires 6 to 8 weeks of casting in the iconic hip spica cast, which extends from the waist to the toes, preventing any kind of sitting whatsoever or use of any kind of regular car seat. So in 1992, the Shriners Hospital for Children, the head office, implemented a system-wide policy regarding safe transportation for all children at discharge. Just around the same time, the American Academy of Pediatrics also specified that, I quote, the plans for procurement of an appropriate restraint and training for the proper use of the device and its installation in the vehicle should be incorporated into hospital discharge planning for all children with special needs. So with these directives, we instituted our car seat loan program. And that entailed initiating contacts with Transport Canada, the Provincial Agency for Automobiles, the Société d'Automobile d'Assurance du Québec, or the SAAQ, and just reaching out to both of these groups for guidance. We were very fortunate also to have made a contact with 2 engineers from the road safety program of the Université de Montréal, with whom we consulted on specific situations, for example, when children would be traveling in their wheelchairs in an adapted vehicle in a cast. We took the time to become familiar with all the various car seats on the market. Something else occurred in this period, which was a terrible tragedy here in Quebec. And what happened was 7 children between the age of 2 and 5 years were traveling in a van with only 1 car seat. and the seven children of the 10 children who were in the car were killed. So this horrible event really accelerated the buy-in at our hospital for the loan program. So just a few comments about what does a loan program entail. The key justification for our loan program was the high cost of special car seats, which was unmanageable for most families, given that they were going to be used only temporarily. And if we wanted kids to travel safely, well, it was clear that we had to provide them the equipment. The first step was to acquire an inventory of special car seats. And of course, the size of the inventory is dependent on the volume of requests. Then you have to consider the costs and negotiate a budget, bearing in mind that these car seats generally cost, well, in the present day, around $600. In the days we started, it was around $400 per seat. And all that obtaining an inventory entails. I mean, it's not just buying them. You have the issue of storage, tracking them, cleaning them, and, of course, making sure that they were still up to date. Then we had to develop a loan form and had to make sure that it was approved by our administration and made sure that it was legally okay from the point of view of the administration as well. And we also felt that running a car seat loan program had an element of education. We had to be sure that the staff responsible for loaning the equipment was well trained on fitting the child in the car seat and as well attaching the car seat into the vehicle. And that's when we had to learn a lot about tethering. We also took the opportunity, as our experience and knowledge increased, to share that information and knowledge with the general public. We hosted various car seat seminars in shopping centers, parking lots of shopping centers, in conjunction with the CAA, and we had various displays on in the hospital with lots of information, pamphlets, and actual car seats on display as well. We also did training sessions for our volunteer drivers to make sure that they were aware of, who should be in a car seat if they were transporting children. So just a couple of slides to show you the usual suspects, if I may say. So here's the Hippo car seat, which is, I guess, our frequent flyer in terms of car seat. We use this car seat quite a bit for any of the children who have DDH, any of the babies. This is really the car seat for kids who are in a spica or hip flexion abduction cast, any young children. And you have the stipulations about how it should be used depending on the weight of the child. This is the car seat that replaced something called the Spellcast car seat, which we used for many years. The Spellcast was initially approved for use in Canada, and the Hippo was also in the early days approved for use in Canada. But since, I believe, 2014, the crash testing requirements and the stickers and so on have not been issued. So in fact, it is no longer approved for use in Canada. And the workaround on that, Nathalie will talk to in a few minutes. The other option is the Traveler Plus, and this is the car seat that we use for the older children who are in some type of spica or casting situation that prevents them from using their regular car seat. And again, the details are on the slide, and you can easily find them on any of the websites that describe this car seat. And as far as we understand it, this car seat still does comply with the CMVSS standard 213, although Dr. Stanwick did mention that there are some discrepancies about that. And then the third one that we use all the time is the Easy On Vest. This is considered what is known in the industry as a custom restraint. I should specify that the one that is used, the Easy On Vest company has many models, but the model that we use is the modified vest. And this is the one that is recommended for use for children in a cast. It's, again, used for older children mainly. In our center, we use it mainly for the older ones because we use the Hippo for the younger ones. And the main thing is that the child must sit lengthwise on the vehicle seat. And this has been dynamically crash tested in the U.S. It has never been approved for use in Canada, and we've always had a waiver on our loan forms explaining this. I just wanted to mention briefly car beds. We don't have one actually in our loan inventory, and they, as far as we can determine, not approved for use in Canada. However, they seem to be accepted, if I can use that term, if they are prescribed and purchased on an individual basis and prescribed by medical personnel. I just wanted to make the attendees aware that these exist. We are actually having some problem right now acquiring one. We would like to have one in our car seat inventory. We have had patients who have, from the States, who use them, and by all accounts, they seem to be quite useful for those particular situations. So now I'm going to hand over the presentation to Nathalie, and she's going to describe what happens here presently.
Well, hello, everyone. I want to talk a little bit more about the most current issue we've had with the loan program. So when we moved in our beautiful new hospital in the fall of 2015, we had to review our loan program, our process, as well as the inventory. We purchased new car seats, including new Hippo car seats, and discovered at that time that they were no longer Transport Canada approved. So we had to find a solution to this roadblock. It wasn't the first one we've had, so like Kathleen mentioned before, we did have a waiver for these young vets that we used before, as it wasn't Transport Canada approved. So our first thought regarding the new Hippo that was not approved was to use that waiver. So we know that every child, we know from the Highway Safety Code of the SAAQ that said that every child sitting height less than 63 centimeters must be in a restraint system or a booster seat that is Transport Canada approved. So we had a liability issue with the Hippo car seat. So we consulted with Nathalie. She is an occupational therapist who works at the Société d'assurance automobile du Québec, on how to best comply with the Highway Safety Code. So she explained to us the Article 398 that stipulates that the SAAQ may issue a certificate exempting a person from wearing a seatbelt or using a restraint system where justified by exceptional medical reasons. So clearly, after this consultation, we realized that this exemption was our best and only option. So today, this is our current loan process. So the child is referred to the OT department. It's assessed and fitted for the appropriate restraint system. Then we we write an exemption letter that is completed and signed by the medical specialist, the OT, as well as the parent signs it. We send that letter to the SAAQ, and it's reviewed for approval. We make sure that we give a copy of that letter to the parents before they leave. Usually takes a few days, a week, I think, before they get the certificate of exemption from this SAAQ. I just put a few links for the Highway Safety Code at the top that you can access. This is Nathalie Drouet. She's been very helpful in helping us figure out a way to get around this. This is, for people from Quebec, this is the address where you can send the exemption letters. We've also attached a copy of the letter we're using. We made a template to make it easier for us, as this is like very used in our hospital currently, like usually every week. So we just fill in the name of the patient with the diagnosis. In that letter, we do include that the child may use a car seat, and we include all our car seats as regulations change regularly. We figured we may as well put every one of them. So we have the Hippo car seat, the Traveler Plus, the Easy on Vest. And usually we make sure we give a copy of that letter to the family, as usually what they're getting by mail from the SAAQ is an exemption just stating that they don't have to use the restraint system, the regular car restraint system. So So that's it for us. Just giving you an example right here of a kid in a cast in a hippo car seat. So.
All right, thank you very much. I mean, that was, again, a great example of how you guys have gone through the process and talked to the people that you needed to talk to in Quebec and found a way around this. So that's an excellent example. We do have a few questions, and Dr. Stanwick, please do jump in on any of these questions as well, as it's definitely generated some conversation out in the audience. The first question that came in was from Janine, and she was saying she was wondering about new models of previously approved products, and just asking how do we find out if they are approved. She's currently trying to figure out if the Max vest, which is part of the Easy On vest line, she's wondering if that's approved, as she works with a number of kids who can and do get out of the regular vest during transport.
Well, first of all, the main way of finding out would be looking for the sticker. But to the best of my knowledge, the Easy On products are not approved in Canada. And if I understand, and maybe Dr. Stanwick can explain, help us with this, but the problem with the vests is that they're considered custom restraints, so they are not made on an assembly line. So I believe the testing procedure is a little bit more complicated. Dr. Stanwick, do you have any information on that?
That's what I was able to glean as well. It is this whole idea. I mean, in speaking to other, to somebody who's involved in that, it's more difficult to come up with the testing procedures than it is sometimes even to design the product to show that it achieves the outcomes that you're looking for. So I think that is the correct explanation, and this is why we really do need to get some sort of harmonization of all of the parties that really contribute to this process. But at this stage, your explanation I think is the correct one.
I mean, I always go back to what used to happen 20, 30 years ago when I literally saw families lift their children and put them in the back of the station wagon, and they drove 2 or 3 hours with absolutely no restraint. So
yeah,
there's not many parents who have, when we go through the big explanation about it's not approved here, but we feel it's the best and safest way to bring your child home, nobody refuses.
Yeah.
And if they do, and sometimes I have to say, sometimes they do, but the only other option is to send them home by ambulance. And then once you're home, how do you get around if you don't have a vest?
Yeah, good point. Good point.
So sometimes they do feel better going at home in an ambulance, but we still provide them with a vest in case they need to go somewhere.
Well, and certainly, as we all know, depending on what the medical condition is, these individuals are probably being transported more than the average child. And so I don't think it makes it very wise to have ambulances transporting these kids. It's not very practical.
No, absolutely.
Yeah.
So so your point's well taken. I mean, it's great to give them that first, perhaps feeling a little bit better, but it doesn't really solve the problem.
Yeah. One of our colleagues from Calgary says it sure beats the dog car restraints that some families have used for their children.
That's unbelievable.
Yeah, but she goes. Her comment was they do the best they can, but it's
sure thing.
Yeah. So, and there was a follow-up question about that Easy On car seat, because that was something we saw in the survey that we did initially. They said, oh, the hippo is not going to be available, but we're fine. We use the Easy On. And just, there's really some confusion about whether it's approved or not. So just to sort of clarify that, we believe it's approved in the U.S., but not necessarily in Canada. And in fact, it's even listed on the Parachute Canada website. That's where this individual has suggested that it's listed. It doesn't list it as approved. It just lists it as a manufacturer of a car seat. So again, it is available but not approved. And again, it's very confusing. So just clarify that for us one more time with the Easy On vests.
That's the way we understand it. That it's not approved in Canada. It's you can certainly buy it. You can get it from the States, or I guess there are other distributors. At one time, we were told by Transport Canada that if you purchased the Easy On vest from a Canadian distributor, that was okay, and I'm using that very lightly. but we were never able to get any satisfaction or any that we were never able to get the vest from that so-called Canadian distributor that was recommended to us by Transport Canada. So,
if I can jump in, that's exactly what they do. In fact, as I pointed out, there were a couple that actually showed the product, but then said basically not sold in Canada, which is a bit of a tease.
Exactly.
And we do have a number of questions from our American colleagues who, and again, this is a very different issue south of the border. She's saying that the hippo seed is not currently in production. Is there something that will take its place or can be substituted? I'm under the impression, just from our limited research and looking at what's happening in the U.S., is that they do have other options that are certified, such as the Easy On vest.
They do, but they're also, the manufacturer has indicated that they do intend to replace it with a different model. I'm wondering if they are having manufacturing problems, because they certainly indicated that there was going to be an equivalent product, but the current one was being discontinued. And that was from their sales manager. Now, I just, again, quoting back what was communicated, there may be further developments.
All right, so we have some other... Sorry, go ahead, Kathleen.
No, I just wanted to clarify, Dr. Stanwick, was that regarding the Traveler Plus or the Hippo?
Maybe you're right. I better check. It might have been the Traveler Plus.
I think that's what you put in your presentation.
Yes, I apologize. Yes, I've had 3 people giving me their communications. We can verify and perhaps add this to the end of the conversation, or just tag it on, and I'll make that inquiry and just add it to this webinar as a postscript.
But this is a trend or a pattern that's been going on for many years, that the manufacturers, produce a certain car seat and it's working well, and then all of a sudden they tell us, oh, we're changing, so this is going to be out of stock, but we're going to replace it with something better. And then you're in this no man's land, so I remember at one point we went out and bought a whole bunch because we thought, well, we better get ready for when we don't have anything. So it looks like it's a pattern that manufacturers tend to do. After a few years they decide to change things, but the manufacturing of the car seat is not in step with the need.
Yeah, and honestly, the impression one gets is that for these companies, this is almost considered a boutique product rather than a mainstream product, and it's the volumes. The other piece, one's always concerned about, and again, I'm not going to make any comments about the American government and keeping America great again, but a lot of these products, in terms of the mainstream, are not manufactured, at least, and I'm just picking on the whole issue of CSA and helmets. They're all made in China now. And so basically you do mass production in about 3 factories. The difficulty with these devices is that this is a very small volume. Maybe a solution would be is if we could in fact get harmonization of standards, and that might increase the American market by a state the size of California, and maybe make it a little more attractive to produce these very critical devices for children's health.
How can we go about promoting this harmonization effort? What would we need to do as users?
Well, I've already basically sent a letter to Minister Garneau, and hopefully we can start the dialogue with certainly CAPSI at the table and the Canadian Pediatric Society and a few others, speaking to the challenges which were so so well captured here by the last presentation. So they do need to understand that they're not helping Canadian children with special needs by taking this stance of Canadian protectionism.
All right, we do have quite a list of questions here, and I'm pretty sure we have about 5 minutes left in our scheduled time. We may go a few minutes over, but I'm pretty sure we're not going to get through all the questions that we have listed here. There was a question a lot related to the loan programs that you mentioned at Shriners. I think others from our survey mentioned that they do have loan programs. How do you ensure that when you loan the seat out and it's returned, that it's not damaged or that it's still functioning in a way that that meets the regulations? Do you have a process for assessing the seat when it's returned?
When we loan out a car seat, every time they return, they have to sign that. They have to sign on the same form. That's a comment that stipulates that the car seat was not involved in a car accident. So, and then we have the car seat looked at, the strap looked at, and we get it washed and ready for the next one.
All right. We have a few questions about sort of alternate methods of travel, so outside of the family car. So, for example, individuals who must travel on a commercial airline to get to and from their home, if they're traveling from a remote area to a large tertiary center for surgery, end up in a cast, et cetera, and then have to return on a commercial airline. How would someone deal with something like that?
You mean the child is immobilized, like in a cast, and cannot sit?
Yes, I think that's the question that they're asking, is if travel involves, someone coming from northern Quebec has to travel to Montreal for the surgery and then returns home, and maybe there's a commercial flight involved in there.
Well, that's not dealt from in this hospital. Usually, social worker are helping us deal with that. So sometimes what they have to do is they have to buy more seats so that they lie down the kid in like a stretcher kind of.
It's referred to as a stretcher case, and it's extremely expensive.
Exactly. If possible, they would use the car seat if it's a feasible option for a little kid. But I mean, otherwise, it's a stretcher case, we call it.
So they typically wouldn't go on a standard commercial flight. That would be like a medical transport type situation?
Sometimes it's a small private aviation company that's able to accommodate that type of stretcher case. This is how we use it, but it's we try to avoid it whenever possible because of the expense.
Yeah. Varsha also, talking about taxis and Uber, she said she had a long conversation with Transport Canada regarding car seats and taxis and/or Uber. And they reported that one can travel without any car seat or restraint in that type of vehicle. Have you come across that kind of information anywhere? Has been my understanding. This is going back a few years, but that it always defied reasoning. But apparently, you're exempt in a taxi. And Dr. Stanwick, is that have you come across that in any kind of regulation?
Yeah, that is the issue in terms of commercial transportation. The rationale is that would seemingly take too much time to do this, though I think a lot of parents can, in fact, request from some taxi companies that they do want car seats accommodated. But again, it's at the discretion between the consumer and the taxi companies, is what I'm aware of. So parents can.
I would refer people to Nathalie Drouin. She would be more helpful than she would know more of the law in Quebec anyway.
Mm-hmm. Emily's asking about the what would, if you are aware of what the equivalent of the SAAQ might be in Ontario. She's thinking of a situation of a client that has surgery in Montreal but is a resident of Ontario and has to travel across boundaries. They've got an exemption based on your letter and the SAAQ regulations, but then they're traveling to a different province. Have you had that situation that you've had to deal with?
We haven't. It's a good question.
Very good. Would it be the Ministry of Transport?
I don't know.
I would guess. I don't know, but that would be my assumption, was that it would be in Ontario. But Justin's asking about the legalities around adding foam or other types of modifications to ensure a best fit in any car seat in order to sort of modify it to fit a child. Is that what would be the legalities around that?
Well, what we know of that, but that's a few years ago when we discussed this with the guys from Université de Montréal.
Yeah, the engineers, yeah.
It was that you stay away from adding anything as much as you can, and if you do, it's better to use like towels that you fold, that not foam, something that's a little harder, like towels and stuff like that, to fill in the empty space and gaps. Yeah.
Because if you use a compressible substance, it makes the positioning of the straps no longer safe or effective. Mm-hmm. This is what we were told by the engineers
a few years ago.
Yeah.
Now, we have another comment from someone in Alberta who's saying, and I don't know if this is Alberta-wide, he's saying in Alberta, he says, our therapists are no longer supported to provide car seats because therapists are unaware if the car seats have been in accidents. He says, therefore, they do not meet Transport Canada regulations. He says they are working with families to buy, so the family would buy these seats prior to the surgery where possible. So he's saying that planning sort of in advance of the surgery to have the car seat available at the family's expense has been somewhat successful in that regard.
Wow.
But again, it's really an issue of sort of putting the burden down on the family, both from a financial and
exactly
financial, but as well as legal.
Yeah.
Yep.
They don't have the exemption. There's still not a car seat that's approved.
Yeah. Randy from Ontario is saying their hospital insurance provider, High Rock, has recommended that they are at extreme liability if they are loaning car seats, since they do not know or have a method to understand if there's been any damage to the car seat on loan, nor a method to critically evaluate the returned car seats. He's asking, he goes on to ask, is there any information regarding CAFC member hospitals regarding current practice? And sort of as we mentioned at the beginning, it's really a dog's breakfast of confusion out there as far as current practice. We don't have any at CAFC. We don't have any information about that. But I mean, it really seems, again, it's a lack of clarity from often from an insurance perspective of what the obligations are and the risks are.
Absolutely, yeah. And I mean, I suppose that's one extreme,
From what I know of car seats, if your car seat has been involved in an accident and that the damage to the car is above $1,000, then the car seat should no longer be used. So that's why we have this in our loan form, asking if they've been involved in a car accident. And if they do, then we would no longer use that car seat. But otherwise, we just do a visual check on the car seat.
No, you raised a really good point. Maybe there is a need for CAFC or CPS to come up with a form that satisfies the insurers. As I say, we certainly from the insuring the physician that writes the letter, there's clearly a need for a standard of practice. Maybe we need to have some boilerplate form that would also alleviate some of those stressors around insurance.
And there may even be an opportunity to work with a national insurance organization, like an association of insurance providers, to maybe have some sort of standard form that would work across the country.
Exactly. Yeah, maybe satisfy their needs. Start from that point. That's an excellent idea.
Yeah. France is asking, she's saying, we currently have issues deciding on whether a child is safest traveling in a non-approved car seat or their wheelchair with tie-downs. What's your decision-making process with respect to whether the child's own wheelchair is the best option?
This is a child in casts, or this is a child like with special needs who whether you use a car seat or whether you use the wheelchair in an adapted vehicle. I'm not clear on the situation. But I understand her. I understand she's questioning which one is safer, a car seat or a wheelchair tie down.
Mm-hmm. Why don't we start with that? Like, what's your recommendation on that? Taking the child out of the wheelchair to put them in a car seat, or traveling in a modified vehicle within the child in the wheelchair?
I'm not sure I have the expertise to answer that, and I would either think that would be something to, again, refer back to this OT who works at the SAAQ and is dealing with these issues all the time, or the engineer, that is really familiar with the dynamics and the physics of. So I'm sorry, I'm pleading no comment.
The only thing I could mention about that is if they're talking about a child in a cast, that's like in a hip spica, let's say, it's not safe to travel in a wheelchair that's reclined.
Yeah.
When you travel with tie down in a wheelchair, you need to be in an upright sitting position. So that's for sure a no.
Yeah, that we've already established with experts.
Mm-hmm. We do have a number of questions about importing seats from the U.S. I think Dr. Stanwick did sort of talk about that a little bit. I mean, it is possible to do. And maybe sort of recap that.
Well, again, I think that, the impression, and certainly from the conversations with the individual who responded on behalf of Manitoba, that it's really at the commercial level that you may run into difficulties getting it across the border by not having the appropriate sticker. But certainly the sense is that as an individual, you can certainly import it. And though the one piece that I really didn't see clarity is, do parents even need an OT or physician's letter to allow this to be brought in? It may perhaps facilitate things at the border, but the suggestion is that as long as you're willing to basically bring it in as a private citizen and pay for it, you can bring it into the country. But that does pose some real problems, like particularly for parents who this may be a significant financial cost. And I certainly wouldn't suggest buying these things on eBay.
Okay.
So part of it is that, it's almost as if, again, that if parents are forced into that approach, then again, perhaps there should be a convenient, again, step through on how you would go about purchasing such a seat. I mean, it does seem that in Alberta, at least there does appear to be some sort of a defined process. Again, maybe it's an opportunity to consolidate some of these efforts.
All right. Now we do have, this presentation certainly generated a lot of questions and comments and everything. We've got a whole list that we've gone well over time. I think we'll have to wrap it up here. Unfortunately, we can't continue on this discussion. Most of the questions are really still about sort of the confusion and options and working around regulations and need for more advocacy, et cetera. So maybe we can just go back to our panel, just to go through, give all three of you a chance to sort of any closing comments you'd like to leave the audience. And maybe we'll start with Kathleen and Nathalie. What key messages would you like to leave the audience with before we wrap this up?
Well, I really like Dr. Stanwick's comment about the harmonization, and I guess what I've been thinking about, seeing how many people attended and hearing all the questions that there were, that I'm wondering if this is something we can maybe build on through CAFC at the annual meeting with with some committee or some group that we can, build a little advocacy core that can help us solve some of these problems across the country.
And Nathalie, any thoughts from you before we wrap up?
Well, yeah, I think Kathleen's right. That would be great to have something that's across Canada, because clearly, like, car seats are changing regularly, and regulations are changing, and they're not always approved, and we get to these roadblocks regularly. So I feel that would be great, because we all work separately. If we can all work together and find best ways to do this for the children.
Yeah, and make one big voice to the government agencies.
No, that sounds like a great idea. If we could, we will definitely have to look into that. And Dr. Stanwick, finally from you, I just noticed we do have a couple of comments from Francine at Pediatric Society, and she's indicated that they've contacted Snugseat 3 times, can't get a response, and sort of getting a non-answer from Britax, and sort of passing the buck, et cetera. So CPS is certainly starting to look into this situation. But what would you like to leave the audience with?
Well, I think, I just reflect on how hard and the amazing amount of fantastic care is being provided both in the community and by our care providers and our institutions. And to see this stumbling block over basically red tape in some instances is something we've got to cut through. Mm-hmm. I'll leave it at that, because I just recognize the tremendous good that's being done, and we've got to get rid of this impediment.
Yeah, no, that's a great way to leave it off. And Sharon also, who gave us the dog restraint comment, that people are doing the best that they can. She also said, what's the worst that can happen? You do the best you can. You try to keep the children safe, and if you get a ticket, if that's the worst thing that happens, it's better than not using anything at all. So
I agree.
Yeah, yeah. So with that, I think we'll wrap it up. I mean, fantastic conversation. It's one of these issues that comes up that is really unique to the pediatric community. It's relevant to every organization, from our rehab centers to our acute care hospitals across the country. So it was really a fantastic discussion. We'll certainly take this away and see what we can do with all of these other national organizations like the Pediatric Society, and maybe getting in touch with Transport Canada and see if there's something we can generate from this. But thanks again to our panelists. Thanks again to the audience. It's a great conversation. When you get a chance to watch live, it's always great because you do get to really enrich the discussion. Hopefully we'll see you back here for our next webinar. We do our webinars every Wednesday at 11 a.m. Eastern Time, and next week on February 15th we'll be continuing on with the advocacy theme and talking about how to succeed with your ideal for change, reflections on effective child health advocacy. We'll be welcoming Dr. Michael Dickinson and Dr. Andrew Link to discuss the latest edition of Are We Doing Enough?, which is the Canadian Pediatric Society's biennial status report that evaluates public policies affecting children and youth in Canada. The presenters will highlight changes to the document, review the principles of effective child health advocacy, and how to apply these, and they will apply these principles to 2 case studies. And then following that, on February 22nd, we'll be hearing from Dr. Astrid Gutman and Shelley Callahan about primary health care reform. What does it mean for children, Canadian children and youth? And this webinar is going to summarize the findings of a CIHR-funded investigation of primary health care services for children and youth in Canada, using a range of sources, including stakeholder questionnaires, national surveys, and other administrative data recently released as part of a new online CICH, that's the Canadian Institute for Child Health. They do a profile. It's a new profile module that's focused on primary care services. So that's going to be a very interesting conversation as well, related from the primary care perspective and how that affects children and youth in Canada. So as always, some great stuff coming up. Thanks again for joining us today, and hopefully we'll see everyone back here next week. Bye, everyone.
Thank you. Bye.
Thank you.